Annual Meeting in San Diego. We're here with Nate Radcliffe from New York. Thanks, Nate, for being with us today.
Great to be here.
Nate, I'd like to speak with you this morning about an exciting new way that we're learning about measuring intraocular pressure. That's CATS tonometry. And I don't think that our viewers all know about what this is, so perhaps you could explain it for us. What is the CATS tonometry system?
So CATS is new. It stands for Correcting Applanation Tonometry Surface, and it's just the prism that goes on the Goldman tonometer. And if you think about it, Tom McCafferty and a few of his colleagues, engineers, basically said, could Hans Goldman really have gotten this right so many years ago? Or is it possible that we can apply modern engineering techniques and science to find a way to make the Goldman prism tip less susceptible to astigmatism, the tear film thickness, corneal thickness, and corneal hysteresis? So they got their engineering hats on. They changed the surface from a flat surface to a biconcave surface. And today or tomorrow, later today, I'll be presenting the clinical data, which I can share with you now, on the outcomes of using this new tonometer tip.
So are the logistics similar, Nate, to what we do now for traditional Goldman tonometry? It's a topical anesthetic and positioning in the slit lamp with applanating essentially against the cornea. So from a logistical standpoint, does the ophthalmologist or technician or optometrist have to learn any new way of doing this?
Right, so one of the beauties of this is in terms of implementing new technology that'll improve accuracy in the clinic, this is probably the easiest thing I can think of. You still use fluorescein, you still use your standard Goldman tonometer, you've changed the tip. In terms of measuring, it's all the same technique with one important exception, is that the CATS tonometer won't give you good Myers if you're decentered on the cornea. So it almost is also helping you be better centered, which is again going to help with that accuracy for pressure measurement.
Got it. Well, let's talk a little bit about the data, Nate. You mentioned that you've published data and you're presenting data at this meeting about the precision and accuracy of this way of measuring intraocular pressure. What are some of the measures that you looked at in your studies?
Sure. So, there's a wealth of clinical data that's shown, for example, in manometry studies where you actually check the pressure in the anterior chamber, that the CATS tonometer is accurate. We're presenting a sort of ANSI standard study validating corneal histories, the CATS tonometer. So you do a couple of things. First of all, you show that in eyes with pretty normal corneal thickness that you're roughly equivalent. But we're also showing that once you get outside of the, say, 500 to 600 corneal thickness range, that the CATS tonometer is less dependent, the measurements are less dependent on thick or thin cornea than Goldman. And that's what you want. Unfortunately, with Goldman, when you measure the pressure for free, you're getting some information about the astigmatism, tear film, hysteresis, thickness. We want that out of the IOP measurements. We can have as pure a pressure measurement as possible. And the data just shows basically that we're less dependent on all of those things using CATS than Goldman.
So can one adapt one's existing slit lamp to essentially just replace the prism or replace the tip of the prism?
Yeah, that's what's so neat about this one is, these prism tips aren't expensive. They are sort of becoming commercially available in the near future. And the replacement is not expensive. So, usually when we're talking about new technology, I'm saying, the downside is you got to drop $100,000 to get this new machine with bells and whistles. In this case, it's actually, in some cases going to be very few dollars. And we're talking like in the single dollar range rather than thousands and thousands. So it's a nice new innovation you can bring into your clinic without making major changes.
Now, Nate, I wonder if this new tonometer tip will help to solve the problem of about 25% of our patients who love to squeeze when we're measuring the pressure and can't seem to keep their eyes open. Does this solve that problem too?
That problem, I think, probably is still going to stay with us. But if you think about it, any step towards better accuracy, and I like to think just knowing the pressure for real is going to help us identify glaucoma. We don't think of using pressure to diagnose glaucoma today, but it's partially because we know there's so many artifacts. Maybe if we get a more pure pressure assessment, we'll start thinking about using the pressure to diagnose and treat glaucoma a little bit better.
That's a really great point, Nate. And again, I thank you for being here to share your expertise with us on the CATS tonometry system, tonometry tip. Thanks so much for being with us. And thank you to our live viewers for tuning in. We appreciate your support.
Great being here. Thank you.